Welcome to Module 5, Corrective Actions and Nonconformances. In this module, you will learn what corrective actions and nonconformances are, the corrective action process steps, and root cause analysis. Let's start with nonconformances. Nonconformances, or NCs for short, result when a product, service, or process does not conform or comply with defined internal or external requirements. In other words, something went wrong with a process, service, or product, and the result does not match the initial specifications. Nonconformances for processes and procedures will be covered in more detail in Module 10 for auditing. This module will focus primarily on product nonconformances. The requirement to control nonconformances can be tied back to Clause 8.3 of ISO 1345, as well as FDA's CFR 820.90. Organizations are required to document procedures to ensure that product that doesn't conform to requirements is identified and controlled to prevent its unintended use or delivery. The organization also needs to determine the need for an investigation and notification of any external party responsible for the nonconformity. For nonconformities found before delivery, organizations must eliminate the nonconformity by correction or return, prevent its intended use by scrap, downgrade, or other means, and/or authorize its release or acceptance under concession. For nonconformities found after delivery, the organization must take actions that are appropriate to the risk of the nonconformity. Organizations must also document procedures for issuing advisory notices in accordance with regulatory requirements. Per Clause 8.3.3, these procedures shall be capable of being put into effect at any time. If rework is an option, the organization must also document the procedure for rework required. The potential adverse effect of the rework on the product should be considered. Rework procedures must undergo the same review and approval as the original procedure. After rework, product shall be verified to ensure that it meets all applicable acceptance criteria and regulatory requirements. Records of nonconformances and their associated investigations and rework shall be maintained. Product nonconformances are typically identified by routine testing, inspection of products and protocols, and/or negative customer feedback. Procedural nonconformances are typically identified by internal and external audits. One type of control an organization may put into place to reduce nonconformances is 100% inspection prior to product release. This, however, may be time-consuming, costly, or impractical for an organization. Once a nonconformance has been identified, a nonconformance report, or NCR, is typically prepared to address the problem. The aim of the NCR is to define the problem clearly, concisely, and logically in order to help identify and implement appropriate changes. Corrective and/or preventative actions are sometimes put into place to address these problems. Let's now discuss corrective and preventive actions, also known as CAPAs. CAPA requirements can be tied back to Clause 8.5 of ISO 1345 as well as Part 820.100. Clause 8.5 starts the ACT stage of the PDCA cycle. Per Clause 8.5.1, organizations are required to implement any changes needed to ensure the continued suitability, adequacy, and effectiveness of the QMS as well as medical device safety and performance. CAPAs are a set of actions that aim to improve the organization's processes and products. Corrective action prevents recurrence, while preventive action prevents occurrence. Corrective action is carried out after a nonconformity has already occurred, whereas preventive action is planned with the goal of preventing a nonconformity in its entirety. The processes described for both corrective and preventive actions are almost identical. Organizations are required to have a documented procedure for corrective and preventative actions. Corrective actions must be proportionate to the effects or risks of the nonconformities encountered. Preventative action should be proportionate to the effects of the potential problems associated with a nonconformity. Corrective action is not required to address every nonconformity. Sometimes a correction is sufficient. A correction is taken to rectify a known nonconformance, whereas a corrective action is taken to prevent recurrence of said nonconformance. Per Clause 8.5.2, organizations must evaluate the need for an action to ensure that nonconformities do not recur. The phrase evaluate need implies that there is not always a need. Organizations should do a risk assessment of each new corrective action to determine the severity and likelihood of the effects of the nonconformity encountered. If a nonconformity is not very severe and/or not likely to happen again, a correction may be sufficient. The CAPA process typically starts off with problem identification. This, for example, can be a nonconformance. Next, there is risk analysis. The organization must identify the risk level of the nonconformance and typically will classify it as high, medium, or low. Justification of the risk level should be documented in the CAPA. Next, we have correction and containment. Non-conforming products should be quarantined or segregated from conforming products and labeled as such to prevent mix-up. How products are labeled when segregated should be documented in the procedure. Next, we have investigation and root cause analysis, identification of corrective and preventive actions, implementation of solutions or actions, verification of implementation, and then effectiveness check. Once corrective actions have been implemented, recheck the entire process. Products should be checked thoroughly over a specified period of time. If the nonconformance is not repeated, it indicates that the corrective action has worked. Finally, we have approval and closure. A tool that is necessary in nonconformances and corrective actions is root cause analysis. Root cause analysis, or RCA, is a systematic process for identifying root causes of problems or events and provides an approach for responding to them. RCA is based on the idea that effective management requires more than merely putting out fires for problems that develop, but finding a way to prevent them. The RCA answers the question, how did the nonconformance occur in the first place? This step is crucial. Unless you identify the reason or reasons for the nonconformance, adequate solutions cannot be achieved. The basic steps to a root cause analysis are defining the problem, gathering information, data, or evidence, identifying all issues and events contributing to the problem, then determining the root causes, identifying recommendations for eliminating or mitigating the recurrence of problems or events, and then implementing identified solutions. There are several methods that can be used in an RCA, such as the 5 whys, a fishbone diagram, a fault tree analysis, and failure mode and effects analyses. We have now reached the end of this module. Be sure to review all applicable procedure-informed templates that Rook has related to the requirements listed in this module. When preparing documents using these templates for our clients, be sure to customize them to what the organization actually does in these situations. Before moving to the next module, take the Module 5 quiz. You must score at least an 80% to pass, and the quiz can be taken as many times as needed.